Here. Bill. I will call this informational meeting to order. The mayor is not here as of yet, so we'll get it started. And I guess we'll turn this over to Leanne Gomes.
City Council and Mr. Manager, thank you for having us tonight. We appreciate the opportunity to talk to you about this very important subject. We'd like to congratulate the new council members, Councilwoman Ella Miles and Councilman Darrell Williams, and welcome back, Mr. Betancourt. Dwell Wilson, and welcome back, Mr. Betancourt. And congratulations to the rest of you who are re-elected. We look forward to working with you again.
Here he comes.
Okay. You have the PowerPoint presentations in front of you, and this was just for your purview later on in the evening or tomorrow. This is an overview of our departments, and I wanted to kind of help you visualize where these grants that deal with substance abuse fall under. They primarily fall under our Youth and Family Services division, and I'm very blessed to work with amazing and talented staff and colleagues in the city, and I hope you are as proud as I am of the good work that we're doing for the residents. The grants for substance abuse prevention are managed, like I said, by Youth and Family Services, help from my caseworkers, me, and our grants administrator, Katrina Rosedale. I'd like to introduce to you the partners who are with me tonight. We have a brand new Director of Youth and Family Services, Erin Hagan, who's our coordinator. And presenting will be Ray Allen Bergman, our Partnership for Success and How Can We Help coordinator. Tiana Powell, our Partnership for Success peer advocate. Captain Scott Suplita from the Norwich Fire Department. Detective Sergeant and my baby brother, Anthony Gomes. Mike like Doyle from Alliance Health. And myself. And we're happy to welcome Stephanie Morin, who's here with us from the Department of Mental Health and Addiction Services. And she's been with us all day doing a program evaluation of our Partnership for Success grant. So thank you for coming, Stephanie. The scope of the problem, substance abuse and addictions, is huge. As you know, it affects all races, ages, cultures, and socioeconomic classes. In our town, we have seen an increase in vaping and smoking. And that while alcohol use amongst youth is still very prevalent, we're seeing a rising marijuana use, which is scary. Norwich is greatly negatively impacted by the opioid epidemic. We're going to go through the strategies that we've implemented to combat each of these areas, and we'll go through pretty quickly so that we have time at the end for any questions or comments that you may have. These are the grants that we currently have under management. And you can look at the totals for yourself, but we have the Partnership for Success grant, the How Can We Help grant, the Drug-Free Communities grant, which we were just awarded, which is a 5-year grant, and the Local Prevention Council. And this means that your human services staff has amassed over $1.3 million in assistance to the city of Norwich to combat substance abuse and prevention and education. The first 3 grants are major grants from SAMHSA that is passed through Department of Mental Health and Addiction Services, and the DFC, the Drug-Free Communities Grant, could be renewed for another 5 years, so we would have a total of 10 years worth of assistance under that grant, and that should give us plenty of capacity to handle these issues going forward. All positions that were hired because of these grants are fully funded by the grant, including fringe and medical, and the city of Norwich has not had to contribute any matching funds in order for us to receive those grants. And we wanted to point that out to you. And I think that the work that we've done in securing this money speaks to our commitment to addressing this issue in our community and helping our residents with prevention, education, treatment around these issues. The goals of these grants are varied. The Partnership for Success grant originally was to reduce alcohol use amongst ages 12 to 20 and decrease the misuse of prescription drug for those 12 to 25. After completing our needs assessment, we modified this to focus on the misuse of prescription drugs and the decrease in mental health indicators, as alcohol was shown to be less of a problem than this cohort who were suffering from mental health indicators. At this point, I'd like to turn our presentation over to Tiana Powell, who is our peer advocate for the Partnership for Success grant.
Hello, everyone. My name is Tiana Powell. I'm the peer advocate for Partnership for Success grant. We did have a short video that we could not play for you, but the video was on, it explains how prevention is about delaying the onset of first use and pushing it back as long as possible in order to protect young brains. The overall purpose of this grant is to prevent and reduce the progression of substance abuse. The Partnership for Success grant works alongside the local Prevention Council and the Norwich Heroin Task Force. The local Prevention Council provides programs and opportunities for youth to prevent risky behaviors such as underage drinking and drug use. The Norwich Task Force is a group of local community members and professionals that covers all substances, substance abuse, overdose prevention, and talks about different types of treatment in our community. The Partnership for Success grant was awarded to the City of Norwich in 2016, and it services those aged 12 to 25. The two focuses of the Partnership for Success grant are non-medical use of prescription drugs and co-occurring disorders. A person with a co-occurring disorder will have challenges with their mental health and be dependent on a substance. With that being said, a long-term goal that we have is to reduce the misuse and abuse of prescription drugs in youth by 3% by 2020, and to decrease mental health indicators in youth such as suicidal thoughts and depression. We have expanded our coalition from 20 members to 45 that represent all 12 sectors such as schools, law enforcement, faith-based organizations, healthcare providers, and government agencies. We have also increased the number of evidence-based programs, curriculums, and other practices to address non-medical use of prescription drugs. Evidence-based meaning it was proven effective. And over the course of this grant, we have reached at least 60 youth in our groups alone in the schools, and that number will continue to rise. And what makes Norwich vulnerable? Norwich has one of the highest overdose rates in the state. A third of the population in Norwich is under the age of 25, which is what the grant covers. And 96% of people seeking help with our recovery coaches already have a co-occurring mental health disorder. In a 2016 survey, a third of youth in Norwich reported a mental health indicator, and it also happens that youth who report these mental health indicators are 3 times as likely to use a prescription drug. Also in the 2016 survey, the number of Norwich youth that reported using a prescription drug not prescribed to them was significantly high. And the problems that we are seeing here in Norwich is that half of our youth report that there is no risk in misusing a prescription drug that is not prescribed to them. And from the year 2015 to 2016, opioid-related deaths doubled from 9 to 18 in Norwich alone. Our main strategies include, but are not limited to, social media, marketing, and raising awareness and trainings. Our community campaign, Norwich Unhooked, and norwichunhooked.org, is tailored for people in Norwich who are looking for any help or education regarding drugs and alcohol or mental health. We are also on Facebook, Instagram, and billboards to get our community more involved. And you can see some billboards we have up here that we partnered up with our Norwich Police Department. And you will also find Norwich Unhooked's informational table at community events in Norwich and surrounding towns to connect with people one-on-one and not just on social media. Some events that we help with are the annual Suicide Prevention Walk, which continues to grow every year, and numerous take-back events. A take-back event is where we partner with the Norwich Police Department for people to bring unwanted or expired prescription medications so that they don't get into the wrong hands. The police department does have a 24/7 drop-box as well. And one of the trainings that we offer to the community is in Narcan. We have recently trained City of Norwich employees and downtown businesses as they deal with the public every day. And we have also trained some Norwich public school staff on mental health awareness to better assess students that are at risk. As a department, we also offer a substance abuse prevention class as a diversion for our juvenile review board, which is a board of professionals that meet regularly to offer children and their families an alternative to the juvenile justice system. And now I will pass it over to Ray Allen to discuss our coalition.
Hi, good evening. I'm Ray Allen Bergman and the PFS and How Can We Help coordinator through Youth and Family Services. So I want to take a second here just to acknowledge the capacity that we have, the relationships, the collaborations, partnerships that have been going on and continue to go on. And the way that we've been able to fund this and look for additional ways to sustain these efforts is really something to take back from this presentation tonight. So I want to take a second just to recognize the partners that have actively supported us in a variety of different ways. So either through continued participation in our heroin task force meetings, which our membership, which was mentioned earlier, is between 45 to 55 members a month. And these have active subcommittees, which we'll talk about in a bit. Or is this could be through our Norwich Prevention Council activities. So here I wanted to break out, before looking at goals, some of the four committees that are pretty active and kind of give you an idea on what we're working through. So the primary prevention efforts kind of can be rounded out as education. Yeah, primary prevention efforts can round it out as kind of education and awareness. Some of these were highlighted with Tiana's presentation. And the evaluation piece is important, and this is really how we kind of gauge our impact and how effective we are in our programs. We look at our outcomes, and these are measured. And we look by gathering data, either by key informants or focus groups, along with our school survey data, which we just surveyed our middle schools and high schools within the area, including North Tech and NFA, and the middle college at Three Rivers. To really see how effective our programming is and where we need to change. Our next group is our overdose prevention. That focus is really to look at kind of the access to treatment and support for high-risk individuals within the community, and recovery and relapse programs. So this is really seeing what sort of supports are there and how we can engage this in a different way. And these are very active supports, including our recovery coach programs. So just to break into those a little bit more, just give you an idea on kind of the goals and some of the things that we're working towards. These are not all, this is just including some, but again, these are a few that are currently, we're building our action plans for these. So the primary prevention group, a few of the conversations have been in conjunction with our advisory board through the Youth Service Bureau, and the thought was to bring in some folks that could talk about vaping issues within the community. So that's another initiative that they brought to this task force to look at how can we bring in a speaker that's going to be effective, that can bring additional information and some programs that can be implemented in the school. So not just a one-time speaker that can cover some info, but how can we bring some additional health education around the topic. We have drug take-back days, and Narcan training was another project that we just implemented back in August at Rosewood Manor. That was an effective date, and that will continue. And so if we're looking at our evaluation group, a few of the goals there. Again, I just mentioned that our surveys had been completed before Thanksgiving. We looked at how we can implement and use that data successfully, and then disseminate that throughout the community. Another set that we would look at would be we compare this to the regional data or some of the information that we get from our different systems. A part of here, Scott is going to talk about our effective OD mapping program in conjunction with a different state map overlays and kind of how that is running and how we're using that. But this is a piece of like our evaluation. So we're trying to utilize whatever resources are available and what we have access to and make sure that our information is accurate and we're not just going off of one list. So if we look at our overdose prevention group, that again is going to be kind of dedicate a little more of that time to one of these initiatives with the OD map, which is a connection with the fire department, our health district, Reliance Health, and a few other partners, including American Ambulance. And another goal that they'd like to kind of achieve would be a legislative breakfast and other advocacy opportunities, because at the point is making sure that those gray areas are very clear, and you understand, we understand all the fine pieces that are, and the fine moving parts that are working within this agency. And the relapse and prevention recovery group. So that focus has been really dedicated to our how can we help grant. So I'll get to that in a minute, a little bit more about that funds, but some of those initiatives are based off our recovery supports. How are we engaging folks at different stages of their substance abuse dependence, and how are we kind of getting them an opportunity to seek the resources or reach out or kind of here's the number, contact this person, or what's the response after an event in the community too. Go to the next. Here I just wanted to highlight a few of these accomplishments by the larger task force. So through some of these partnerships, a few things that have come up would be our drug interdictions, which again, another one of our partners is going to highlight a little more about their connection with us. But a drug interdiction is basically a police sting. And these successful events are conducted in April and May with 7 arrests, including additional information and other, taking other substances off the street. And the target was for opiates and what we can kind of seize or make the connections to those higher ups. So these were successful, and this is a strong partnership that was effective. Another one is our OD study. So we were able to, through some connections with our past alderman, Sam Brown, to really connect what we have at the medical examiner's office, the city clerk's information, and additional sources in our community, which includes some of our OD mapping, and those numbers that we're working with the fire departments and their responses. We had the Root Center in this community right here in Norwich was closed for some construction, and that caused an issue with the clients. If you are interrupting service, they had to either go to London, I think Willimantic was the other location. So through this partnership, we were able to connect with Norwich Human Services, connected with St. Vincent de Paul, and made sure that there was a van that was going daily to make sure that our individuals within the community here in Norwich had a place to go to get that treatment. So again, breaking down the wall with that for access. And the mobile needle exchange program, that's another initiative that we're constantly working on, and where's the best locations and where to go, and how we seek in the right clients. Small but big. So Carlton here is our Take Back Pup. So we're really excited that with some of these initiatives with the police department, Carlton was one of our media posts about make sure that you're dropping off your unused medications. So we understand that in the wrong hands or people unaware of the dangers for youth, using this can be have its own issues. So our drop box is in the police department that can be dropped off anytime, 24/7, without questions. And there's even a different exchange for needles. So like the safety issue is not a concern, and there's somebody that is always kind of watching the lobby there. But within the last year, I think, including some of our mobile take-back days, we take the van, they accepting drugs if they'll meet them out at an event, like we had our suicide awareness walk in April, or May, sorry, it was May. But there's about 210 pounds of drugs that were turned in within the community. That's just throughout this county here. And another one would be our youth leadership program that we worked on together with the 2 middle schools, Global and Kelly, and made that connection with our leadership program at NFA. So a few of these connections have really built into something strong. So how can we help? Kind of looking forward. This is this is our recovery coach focus program, but we're not focusing this only on our recovery coaches and getting more coaches. We're actually trying to make sure that they're making those connections. We're targeting different subpopulations within the community here. Some of our care packages would be made for new parents or mothers seeking additional help. We're going to be looking at different psychoeducation groups and media and campaigns and billboards for the community, just to make sure that the right message is getting out and we're sharing that. And our next step for the Norwich Prevention Council is that the partnerships are there and we had the right people at the table. So one of the great achievements that we have for this year is that we're an awardee for the Drug-Free Communities Grant. And the Drug-Free Communities Grant is, again, $125,000 a year. It's guaranteed for 5 years, and it can be up to 10 years worth of funding. And this is primary prevention-focused efforts. So try to make those, kind of make those pretty clear about the different goals that we're seeking, but this is a piece of what we do. This is not the only thing that we do. There's a variety of approaches that we're working on, and there's a lot of different efforts, but we definitely utilize the best that we can, make this funding efficient for where we have it, to really reach out in the community. So I want to turn it over to Detective Sergeant Anthony Gomes. Thank you.
Thank you for having me. On behalf of the Chief of Police, I know he's very proud to be part of this partnership. We need programs like this to combat this crisis. Forming these partnerships, it becomes very apparent as a police officer that we cannot arrest our way out of this problem. And these partnerships give us the opportunity to work on things like the community and reach out to people and get them services. One of the most effective ways we can do that as a police department is through our community policing unit. They're sort of our boots on the ground, so to speak, our focus group. Every police officer in Norwich is a community policing officer and deals with the community and approaches policing in that manner. But the community policing unit can not be a slave to the radio and calls for service and really attack this problem. And kudos for the task force for utilizing the chief of police and the community policing unit to go out into the community and form partnerships, hear the families' problems, what they've experienced from this crisis, come up with alternative ways to combat it. Very effective. We cannot arrest our way out of this problem. The Juvenile Review Board, that's all about services. Instead of inundating the juvenile court with arrest or juveniles that have to be initially placed under arrest, we can send them to the Juvenile Review Board and find alternate services other than actually sending them to the juvenile court system. Great strategy on combating a crisis like this. A lot of these juveniles are affected by this crisis, the opioid crisis, and a lot of times that's simply why they're acting out and getting into some trouble in the first place. I personally dealt when I was in the records division with the RX drug take-back, and I can tell you that that is a huge success as far as removing prescription drugs from the community we all live in. Thousands of pounds of drugs are dropped off. That box gets filled sometimes twice a week, the small box you saw in the previous picture. It took me and another officer in a pickup truck to load all the drugs that we get back on a regular weekly basis just to go to the incinerator to destroy these drugs. And we also have the van that goes to special events. And another great idea, hey, you're having a special event, you might as well have one of these vans and have your drug take back right there available as the event's going on and announce it beforehand, and people drop off the drugs, in addition to working with the National Guard and various other community events. It's a very, very successful program. The community event participation, this is something that's near and dear to my heart. Although I work in the detective division now and I see the effect of the opioid crisis on just about every crime that comes across my desk. Forming partnerships with the community at these events is one of the things that's near and dear to my heart, being a former DARE officer and a school resource officer. It's where, quite frankly, we're a little bit lacking right now from a police standpoint, and being involved in this partnership gives us the opportunity for these kids to have a positive police experience with an officer. So valuable when dealing with a kid, especially a kid that might have some issues in his family, or maybe his parents are affected by this crisis, or something bad has happened to them in their life due to this crisis. And once again, we need partnerships like this to effectively combat crime, because this crisis is affecting all areas of crime: violent, burglaries, just about every facet of what I deal with on a daily basis is affected by this crisis. So appreciate you having us in your partnership. It's invaluable to us, and I know it's invaluable to the Chief of Police. And if you have any questions, I'll be happy to answer them at the end.
Okay, did everyone get a door hanger? Okay. She's passing out right now is what City of Norwich Fire Department leaves after we go to an overdose. That gives them the information that they need to know. We've got good feedback from it. We do have people utilizing it. It might not be the next day, but it does happen. Okay, Norwich Fire Department's role in the task force is tracking both fatal and non-fatal overdoses that we respond to in the CCD. So the numbers that I'm going to give you in a little bit are just our numbers that we get from the CCD in our response area. So we utilize a GIS overlay that was created with the help of MPU, and we're able to plot on the map pertinent information of the type of overdose. They're not all opioids. There's prescription medication overdose that we respond to. The pertinent information of the overdose, the location, the gender, the number of Narcan doses that we will record, because sometimes the family, now we go there, there's so much out there, the family's given it, who gave the dose, whether contact was made with the family, and whether a door hanger was left. So that door hanger was thought of, I think, in May of 2019, right? And it's been awesome. We then, when I plot this on a map, I'll go all the pertinent information. I'll email Leanne. She's able to get a recovery coach out there from Reliance House pretty quick. Just to give you some numbers, in 2018, we responded to 34 overdoses in Norwich in the CCD. 2019 right now, we're tracking 55 overdoses that I plotted 31 non-fatal and fatal. So it is a problem, but it's been invaluable to get people out there right away, because I think the quicker they get out, the more that they're able to do. We're talking about the mapping system. We have a GIS map, but we also utilize OD map, which we got access to, I think, a week or two ago through Uncas Health District. So we're comparing our numbers that we plot with their numbers in the state. So we can track those numbers down by street level. The numbers that we have in the City of Norwich Fire Department are down to the address. So we're giving them addresses, they're going out, they're knocking on doors. Sometimes they get angry people, sometimes they don't. People that want to get some help. So that's our role in it. Yeah, that's the whole opiate epidemic numbers. Our numbers are going to be different from I think your numbers there, because we're just CCD numbers. We're reaching out, we're trying to get the numbers from the whole city. So we're just trying to share the information.
Just again, I'm Mike Doyle with Reliance Health. I'm the program director for the Recovery Coach program that's in the partnership with the Heroin Task Force and Norwich Human Services. We run out of Reliance Health. Just kind of wanted to give you a quick overview of what that program looks like. It actually started as a pilot program with 211 that has since morphed into the Recovery Coach program. And this past, I think it was November, we started in November of 2018. Right now, we have 2 recovery coaches covering Norwich. One is full-time, and she's been the recovery coach since the onset back in July or so of 2018. And we've added a part-time recovery coach this past May through additional funds through DEMAS. As I said, I oversee the Recovery Coach program, and I oversee the Penobscot Place program at Reliance Health, which is a recovery-based day program, which the members of the the people that are using the Recovery Coach program also have access to that as a kind of a go-along with the Recovery Coach program. Those of you who are not familiar with recovery coaching, the simplest way to put it is it's a peer-based professional. We're out there working with the people who are struggling with not only opioids but other substance use concerns. We're trying to really meet them where they're at. Sometimes that recovery coach is a link to treatment. Sometimes that recovery coach is a link to the recovery community. Sometimes it's a resource broker to get them in touch with some of the other benefits that they might be eligible for and aren't familiar with. And other times it's simply out there to just plant a seed of hope that, you know, recovery is possible, and when they're ready, we'll be there. And Scott alluded, Captain Splita alluded to that with the door hangers. That's really what that is. That's that first touch of planting that seed of hope. The referral process for the Recovery Coach program starts with the collaboration in town at our community cares team meeting, along with our heroin task force meeting. It all kind of flows through that. Providers in the community come together, and we are all able to discuss the people in the community and reach out to those that need the help. We also have the partnership now with the first responders, and the one that's really been taking off and growing here recently has been with the fire department, to where when they are administering Narcan and there are overdoses in town, we're then able to get the information and do outreach to the people and go and knock on the doors. And Scott mentioned something about sometimes the people are angry. I will tell you that we've had a couple of responses where they weren't that happy that we were there, but a lot of times that response comes from a little bit of guilt and shame. And that my wonderful recovery coach, Deanna, who's been here since the beginning, turned one of those angry, threatening phone calls into a relationship with the person that we're working with, because they just really needed to see somebody that was there and was actually there to see them and meet them where they were at. So we also still have a partnership with 211. We have still on occasion receive referrals that come through. People can call 211 and they refer them directly to our Recovery Coach program. I actually sent around the harm reduction kit. The harm reduction kits are what we actually take out when we meet with people. It's a leave behind. We kind of keep it in that nice kind of gift bag thing, so you don't really see, you know, we don't really want to bring something out that's like, hey, you just overdosed on the side of it or something. You know, it's something that we bring out to help people, again, trying to meet them where they're at. If they're not ready for treatment, there's a safe use kit in there too. And one of the reasons that we do that is because the people that utilize the safe use kits and use needle exchanges are 5 times more likely to seek treatment when they're ready for it. We also have Narcan in those bags and directions on how to use the Narcan, a link to the DEMAS online training. And we also have, I think there's a journal in there, as well as a stress ball and some contact information, kind of a nice leave behind for the people that are there. As far as the trends and barriers, I'll get to that after we click on the next slide here. Some numbers for the first year program participation, and we've worked with about 85 members so far that have substance use concerns, and we've also worked with another 34 friends and families. We've given them the support that they needed, put them in touch with support groups, or just been there to listen and to educate. We've done Narcan training for some of the family members and provided Narcan for them as well. So we've made contact with over 109 people, and of the people that we're working with, 75% are still actively engaging with the program, and we've identified 95% of the people that we're working with identify at least one opioid, and 74% of the people we're working with have used 3 or more drugs, or report 3 or more drugs. So it's not just, you know, the opioids that are an issue. And we talked about the co-occurring mental health earlier. And one other thing that I wanted to point out that this program has helped do is that 100% of the people that we're working with have gone on to identify at least one additional basic need, whether that be housing, benefits, a transportation issue, they need to get food, or it's a mental health concern. We're able to link them up with those type of things. Some of the barriers are the same ones that we talk about all the time. Sometimes insurance, there's limitations on insurance. Sometimes there's limited access to beds of treatment. And that's about the long and the short of it. I think I'm going to turn it over to Leanne now, in case there's any questions.
We don't want to go long. We appreciate your time, but we did want to see if you had any questions. That's a ton of information. Please know that you can contact us and ask us more questions if you don't have time tonight, or if you want us to explain something a little bit further. But if there's any questions, we'd be happy to field those now.
Members? Yeah, Alderman Bencourt.
Please don't think I think this way, all right, but I'm going to just play devil's advocate, you know, because certainly it's something I've heard before. How would you respond to somebody that says, well, a lot of these people are violating the law and stuff, why are we spending, you know, money on these kind of programs if they're just lawbreakers?
Yeah, because if it was my son or daughter, I'd want to save their life first and then address those issues later. And I will defer to my partners if there's a better answer. I'm sure my brother might have something. I think if
How about addiction shouldn't be a death sentence?
right, addiction shouldn't be a death sentence, right?
Go with that
Homelessness shouldn't be a death. But if I believe the law is that if you know, someone's overdosing and the police go out and they find drugs or paraphernalia, there's no arrest then. The main issue is treatment. We got to get that person into treatment, and that issue was kind of put aside. Am I right there? Yeah. So I don't know if anybody else wants to say anything there.
Basically, the courts have decided that they're not going to prosecute in the overdose situation because it is simply the gravity of it inundates the courts. Services.
Well, yeah, you'd rather have them get treatment versus, you know, I mean, what are they going to do, take a shot at not getting treatment? Well, they'd be dead. You know, so.
But the very least, also with the resources too, if you have to accommodate for one individual, that is, you know, with dependents, and you need to respond to that house, again, that additional response has additional monies for the town or the town and the city.
No.
So by assisting that person to find treatment and find a way to cut back on use, that ultimately is going to be saving the money in the long run for not only the person, not only saving a life, but saving additional resources.
There is a protocol from the court too on what we should do in that circumstance, and most of it is predicated on trying to catch the person who and prosecute the person who sold the drug. That's why we seize in a lot of these drug overdoses. We seize their cell phone, we collect information, we treat it like a criminal investigation, all in attempts to hopefully prosecute the deal.
Thank you.
Yes.
I
Alderman
was
Nash.
glad to hear the outreach to the youth and stuff like that. And as you know, I was also a former DARE officer, and I've been out a long time, so I know the program evolved and changed a lot. But do you think there's any benefit to reinstating that program with the connection with kids? Because I'll be honest with you, in all the years that I was a cop, the most successful years I ever thought I did the job was when I taught the DARE program, because I actually felt I prevented situations versus when I was the juvenile detective investigating the situation. So do you think if we could somehow reinstate that program? I don't know how the program's evolved, so I'll leave that to you because you're closer than I am to it.
I can only speak for me. I don't know if this is the department's direction, but I've done just about everything in policing, not to pull my own chain, but I've caught the murderer, I've investigated the big case. The most gratifying thing I've ever done in my police career, or categorically, is work with children, and it's where I made, in my opinion, the most difference. As a school resource officer, as a DARE officer, you see when they have a positive interaction with the police, they automatically say, oh, TV is not correct. This cop is playing and joking and having a good time with me, and that pays tremendous dividends and future criminal investigations and cooperation with the community and the parents coming on board. And having that contact is just invaluable. I mean, it's something you need to try to do at all costs if at all possible, but just for that benefit.
I think what we're trying to do through the substance use prevention class is similar. It's just like you said, sorry. It's like you said, the programs and the needs are evolving. So it's about educating the kids about what the substances do, how to use those refusal skills, and then what to do instead, right? Because a lot of times kids are starting to use substances because of those mental health indicators, anxiety, depression. So we're gonna tell you, don't do drugs because they don't work. Now let's tell you what to do instead. So that's kind of the evolution. And then with the police, we didn't get a chance to talk about it much, but we had the Joining Forces program that we've run for 2 years, which is a youth leadership program. And
Yeah,
they,
I've been to your dinner.
yeah, and
It's
the
very exciting.
officers go and they hang out and do lots of fun things, but then also build relationships. So when they run into those kids in the community, they see them as a support.
Thank you.
Other members? Thank you very much.
I hope you're as proud of these guys as I am.